Culturally sensitive care is critical for Black communities because we face higher mortality rates in a very variety of healthcare issues. For example, in the COVID-19 pandemic, breast cancer, maternal health care, other host of issues in which Black people face more negative outcomes than other Canadians. Hi, I'm Julie Shabawali, Executive Director of Black Physicians of Canada. Black Physicians of Canada supports and amplifies Black physicians and medical students across Canada. We support them in their leadership, mentorship, networking, and community building. I have family members who've been directly affected by certain diseases like sickle cell disease and cancer, specifically breast cancer, and they were able to get the care that they needed. And it was really helpful for them to have somebody from our Black communities as part of their healthcare team. One of the examples in terms of patients and lived experience comes from an Ontario study in 2024 related to Black maternal health care. They asked mothers who had gone through the birthing experience what it was like, and they spoke about isolation, they spoke about not being seen or heard, and they said that they would have liked to have someone who was from the Black community as part of their healthcare team because they felt like perhaps people didn't understand what they were coming from.
I think it's extremely important for me to have someone who's had the same lived experience as myself. For me, there has to be like some level of trust. And I feel for me, it comes around in someone who I can relate to me, I can relate to them. And it just flows better because, in healthcare, most times it's your most vulnerable moments. So I feel like the trust is important. And I've found that in providers who share the same culture or, same background as myself.
When we found out that we won the grant, would love to say I didn't jump up and down, but I did. And I called every person that I could think of. And one of my board members, she sent me a text that said, "Julie, we did it." And it had, the emoji with the tears falling down on the face. We were just so pleased to find a partner who believed in these issues as passionately as we do. The project that Novartis is funding is focused on access to healthcare, specifically access to culturally sensitive care. We want to create a national database of Black physicians so that if they want to refer someone to a specialist, they'll be able to find somebody who they know who is focused on culturally sensitive care. And then we're also going to revamp our website to have a Black digital hub so that Black communities can be able to find out what other people are working on in relation to Black health equity and also be able to access more resources. Just to give you an example, we already launched our study just to get a baseline idea of how many Black physicians are out there and what they're working on. We've already received almost 200 responses from that survey alone. And so the response has just been so positive. We've talked to so many community partners already who are already ready to amplify the work that they're doing, not only on our website, but in our social media channels. And so we're so excited to have this project move forward. If I had to describe the Novartis Health Equity Initiative in one word, I would say empowerment. I feel our organization is empowered. I feel like patients will be empowered. I would love to have that for every Canadian.